So we've got 4 PhDs and 2 medical doctors working on this product in our London lab, and we export it all around the world. So how does it actually work? We've got loads of big terms: bioavailability, micelle formulation, NF-kappa B, transcription factors. All of this stuff is all what the scientists talk about. And to be honest, some of the times I'm just barely keeping up. But let me tell you how I think of this. So we've encapsulated curcumin in tiny little oil droplets, which we call micelles, along with cinnamon and some green tea saponins and some other plant compounds. So when we put it in water, it actually becomes soluble. So normally curcumin will float and then hit our cell walls and just bounce around, as you'll see in our video. So what it's doing by getting translucent, becoming water soluble, and when I drink it, my cells can actually pull water through. So the curcumin with all of these other plant compounds come through the cell walls into our bloodstream. Now, in medicine, there's a term that something's in the body or it's out of the body. And me as a layman, I was a bit confused by this initially. The scientists and the doctors say something is in our body when it passes through the cell wall. That's essentially what KURK's doing. So we're getting the curcumin and all the plant extracts to pass through the cell wall. Then once it hits the bloodstream, it fires off through there and it reduces a transcription factor, NF-kappa B. What that does is a series of switches that reduces the amount of inflammation that our bodies produce. Now we've got good inflammation. That's really part of our immune response. If we, roll our ankle or hurt our wrist, we'll get a lot of fluid and inflammatory markers come there to tell us to stop doing that because we want to let our tissue heal. That's good inflammation. But after a certain period of time, 5 or 6 days and even months in some cases, inflammation becomes what they call chronic or dysregulated inflammation. That's DYS for anyone that wants to search. And when something becomes chronic, it's not helpful for the body. If it's been over a few weeks and even a few months, if you've got that same joint pain or back pain, the doctors will call it chronic, meaning it's not just an inflammatory response trying to make you reduce the load on that particular joint. And when it becomes chronic, it can stay for a long period of time. And the biggest problem with chronic inflammation is it'll stop you from pushing your body forward. So all of a sudden you've got that sore neck, that sore back, so you won't go on that walk, or you won't go to the gym, or you'll reduce what you're doing in lifting weights because you feel a little sore. That's actually the opposite of what you want for longevity. Our bodies are what the physiotherapists call anti-fragile. Our bodies get stronger the more we push resistance into that. Dr. Harry's My Performance Doctor Clinic, where he looks at longevity, he will focus people on lifting resistance, so heavy weights, and trying to look at other ways so they can build bone density and muscle mass, because that's the secret of a really strong health span. And so what we are doing now by reducing the inflammation is I'm able to train a little bit harder, or I won't feel as sore the next day, so I'll still go back and train. So the real benefit of taking KURK is being able to continually push yourself, whether it be on your sport, whether it be a social activity, whether it's playing with your kids or your grandkids. You've got to keep pushing forward. The key to real fitness and what really professional athletes will tell you, the difference between them and most of the other people is the athletes can push through pain barriers. They can drive things harder. They can run that bit faster. They can lift a bit heavier. And the reason is because they understand the mental side, but they also understand that it's good for the body to be pushed through pain barriers. The main benefits of KURK is we can take it every day. It doesn't have the side effects of ibuprofen or a lot of the other medications. I've been taking this every day, and the times I stop is usually when we're doing a clinical blood trial. I have to do what they call washout. I've got to get all the curcumin out of my body. So for 2 or 3 weeks, I do that. And when I do it after about a week or two, I feel these 3 fingers, the joint pain from jiu-jitsu and boxing I used to do, that comes back first, then the neck getting sore, then the left hip, and then sometimes the left knee. And then once we go into the clinical trial where we're measuring blood tests based on dosage and I'm able to take KURK again, within about a week, I feel those pain points reduce. And then over about 2 to 3 weeks, I'm back to where I need to be. It doesn't mean I'm completely cured. Some days I am sore. Some days I am a little tender in those areas when I've really pushed my body. But what this does for me now, I'm measuring all of my sleep and all of my resistance training and my CO2 max, my VO2 max, the blood oxygen level, all of this stuff. And I've noticed a big improvement in my sleep when I take KURK at night. So I said to Harry, why is that? He said, look, his hypothesis on this is the reason we wake up during the night, a lot of the time it's room temperature or noise. But the other reason is we're a little sore. Sometimes we're sore in one spot, so we will change position and that disrupts our sleep. So when I started doing this, and a lot of people in different trials where we'd look at who's actually mapping their sleep, we would see if they take KURK in the nighttime, they were actually getting better sleep results. Now, the whole idea of this is completely safe. We've made it taste as good as we can. And we're focusing on improving what we know about KURK. And what we need for that is a lot of feedback. So we run all these clinical trials. We constantly ask our customers in our community how it's working, what do you want to see a bit more of? And then we're working with a lot of professional athletes, these people that are really doing a lot more than everyone else. And we're trying to sort of get a real base case on how we can help people and make sure we can get more people stronger for longer. So give KURK a try. A lot of people come on and follow our content because we're looking at interesting parts of longevity and sport as we age. Give us some feedback. What do you want to see more of? And we're here to help you. So from myself and Dr. Harry, thank you for listening this far. And if you're going to try KURK, vanilla in milk is my favorite tip.